that we can put patients in to help them to confront their fears and anxiety disorders. The World Health Organization, we can develop virtual reality simulations that we can put patients in to help them to confront their fears. We can develop virtual reality simulations that we can put patients in to help them to confront their fears and anxiety disorders. The World Health Organization, I think, put out a stat, something like 60% of people with mental health problems never see the inside of a therapy office in their entire lifetime. So if we can create more engaging forms of treatment by leveraging these kinds of technologies, we may draw people into therapy. When you think about clinical uses of VR, the best metaphor is aviation simulation. So just as an aircraft simulator serves to test and train piloting ability under a range of controllable conditions, we can design virtual reality environments that help us to test, train, teach, or treat human function across a wide range of areas. One of the areas that we've really focused on quite a bit is on treating PTSD. We create simulations of provocative settings where somebody might have had a traumatic experience and help them to go back and confront and reprocess very difficult emotional memories, but in a safe place. Also, we've worked in specifically is with people with autism spectrum disorder. And these are folks that oftentimes are very capable of doing a job and of getting employment. The problem is they often have a lot of anxiety around social interaction. So we've built out a job interview training system using artificially intelligent virtual humans. And the characters can serve the role of the job interviewer, and the person with autism can practice. And they find it more comfortable to practice with these virtual interviewers than if they were to role play with a real person, because virtual human doesn't judge you. So it becomes a safe context in which to practice skills without feeling like you could be embarrassed or be at risk for not doing it correctly with a real person. Can a technology be something that you can develop a business model around where you can generate revenue? So licensing arrangements and perhaps giving these low-cost headsets to practicing clinicians with a per-use licensing fee, where pretty much want to make the hardware almost freely available. But every time they use the software, if they want to get their data and the reports, that data goes up in the cloud, gets analyzed, and you have to pay for the report. In the future, every clinician will have some type of virtual experience at their beck and call, when you can open up your desk drawer, pull out a headset, give it to a client, maybe go on your tablet and say, okay, we're going to do the fear of flying scenario, and now they're in it.
The S&P 500